Cervical cancer sadly affects 660,000 women worldwide in 2022 per the global estimates, and we lose over 350,000 women to this disease. So once again, it's really sad that we're talking about cervical cancer, especially since it is preventable with the use of pap smears as well as the HPV vaccine. However, it's good to know that there are options for women, especially if they're found to be an early stage. How do we define an early stage is typically by first physical examination. If it is really thought to be an early stage and it doesn't have a visible lesion, then sometimes a cold knife cone biopsy or a LEAP procedure is offered to women in order to see if it's a microscopic early stage cervical cancer. If it is, sometimes this can be both diagnostic and therapeutic, especially in women who are interested in fertility sparing, as well as if it is thought to be a larger lesion than that. If it's less than 2 centimeters, then maybe you could have a re-excision with a cold knife cone or a LEAP, as well as potentially sentinel lymph nodes to be done in order to ensure that there is not any extracervical disease. If there is extracervical disease, then really surgery is not an option for these women. So we have two big trials that helped us shape the way that we can hopefully decrease the radicality of surgery for women who have an early stage cervical cancer. And that is both known as the CONCERV trial, CONCERV, and the SHAPE trial, which both help us realize that we can offer women either hopefully just a big excision of their cervix with sentinel lymph nodes versus maybe a simple hysterectomy with lymph nodes. If a cancer is thought to be greater than 2 centimeters, but still less than 4 centimeters, and there's no evidence of extracervical disease by PET CT imaging, then they can be also offered potentially a radical hysterectomy. The reason a radical hysterectomy can offer more side effects is in the terms because it does disrupt nerves that go to your bladder and bowel, as well as potentially partly affects sexuality in the future because part of the upper part of the vagina is also removed. However, early cervical cancer is highly curable, and that is really the goal of surgery. If it is detected that on a PET imaging that there's more than extracervical disease, then the patient would warrant chemotherapy and radiation and is not eligible for surgical attempts. The key is to make sure that you meet with a surgical oncologist to assist. And this is a multidisciplinary team approach with both radiation oncology as well as radiology to help tailor the best treatments for women. So once again, hopefully people will realize that there are lots of options, but the key is really to see your gynecologist to get your screening done and to ask about what your options may be.